have you lying in semi-fowlers, I'm going to look for your apical pulse. When I see it, I'm going to palpate. It should feel like a short, gentle tap. And the apical pulse is the point of maximal impulse. Next, I'm going to palpate the heart's borders, the sternoclavicular, the aorta area, the pulmonic area, and the ventricular area. We're assessing for pulsations, heaves, and thrills. Next, I'm going to auscultate the heart. I'm going to determine the rate and the rhythm and listen for normal heart sounds S1 and S2. I should not hear an S3 or S4. I'm going to start at the aortic. Pulmonic. And the tricuspid. And the mitral. Next, I'm going to inspect your abdomen. I'll look at the skin for any scarring or hernias, rashes, striae. I would look, it should be flat with no protrusions or bulges. It should be symmetrical with visible peristalsis and pulsations. The umbilicus, we would check it for hernias. It should be midline and inverted. Next, I would auscultate the abdomen, starting at the right lower quadrant. Should hear normal bowel sounds. You could hear hypo or hyper or absent bowel sounds. We would listen to all four quadrants, and before you charted that it was absent bowel sounds, we would need to listen for 5 minutes in each quadrant. Now I'm going to swap to the bell of my stethoscope and listen for the vascular sounds. Listen for any bruits in the aortic area, the renal area, and the iliac area. And the femoral. Next, I'm going to do percussion of your abdomen. We'll percuss all four quadrants. You should hear dullness over your solid organs and tympany over the air-filled organs. Now we'll lightly palpate the abdomen. Use my fingertips and start in the right lower quadrant and move clockwise. The skin and the muscles should have good tone but should not be taut. We're assessing for any tenderness, masses, any muscular guarding. And now we're going to do deep palpation. This is going to push in a little bit harder. It's going to be about 5 to 8 centimeters. Just noting the size and the location and the mobility of the abdominal organs. Should be no tenderness or enlargement or masses. Next, we're going to palpate your liver. I'm going to slide my hand up under you and slide my right hand under the right upper quadrant. And ask you to take a deep breath. And feel the firm liver on with inspiration. Okay, now you can sit up. You just sit right there. And inspect his skin and his arms. And palpate the arms. There's no swelling, no color abnormality. I should also palpate the pulses. They should be equal, not weak. Do the radial and then the ulnar. And next we do the brachial, also equal, not weak. We check your capillary refill. Should be less than 30 seconds. It's good. Let's do this side too. Now let's check the range of motion with your shoulders. Raise your arms up above your head. Put them down. Now hyperextend them back behind your neck. Okay. Now put them out and in. Okay. We'll check the range of motion of your elbows. Let's flex them and extend. Flex and extend. And now pull them up. Now put against me. Okay. Now we'll do the range of motion of your wrists and your hands and your fingers. Flex your wrist. Okay. Now touch your fingers together. Okay. Spread and close your finger. Make a fist. Alright. Alright, now we're going to check for sterignosis. I want you to close your eyes. And open your hand. Close your eyes. Can you tell me what that is?
Quarter.
Okay. Now close your eyes. And the other hand. Can you feel what that is?
T.
Okay. Next, we're going to check your deep tendon reflexes. So, I need you to relax your arms.
Do you know what hurt on that?
Yeah. Okay, the reflexes could be anywhere from 0 to 4. 0 is absent, 1 is decreased, 2 is normal, 3 is increased, and 4 is hyperactive. So first we're going to check your biceps. Just kind of. Okay, and then we'll do the triceps. And the brachial. Okay. We'll do it on this side also. Okay, next we're going to check your cerebellar function. We're going to ask you to pat your hands on your legs and increase it in speed. Okay, now do it the other way. Okay. We did the thumb to finger thing. Hold your arms out.
Hey, I gotta stop you right there.